Greetings, my friends. This is Dr. Jaime Daniel, and today I want to share with you an overview of osteonecrosis. The bones of the human body are made up of living cells that need a blood supply to stay healthy. In osteonecrosis, blood flow to part of a bone is disrupted. This results in death of bone tissues, and the bone can eventually break down and the joint will collapse. Osteonecrosis is also called a vascular necrosis, a septic necrosis, ischemic necrosis of bone. Osteonecrosis can happen to any bone, but most often it develops in the end of long bones, such as the femur, especially the upper part, the ball in the hip socket. The lower end, which is part of the knee joint, is also often affected. Upper arm bone, known as humerus, especially the upper part, the ball in the shoulder joint. When the disease involves part of a bone in a joint, it can lead to the breakdown of the bone and arthritis. Less often, the bones of elbows, ankles, feet, wrists, and hands are affected. The primary symptom of osteonecrosis is pain, and your doctor usually may diagnose this disease by using imaging methods such as X-rays or magnetic resonance imaging. Most people require surgical treatment to prevent further bone damage, to protect the bones and joints, and to improve use of the joints. People of any age can get osteonecrosis, but it is most common in people in their 30s and 40s. Cases of osteonecrosis that stem from an injury are said to be traumatic, while all other cases are considered non-traumatic or traumatic. Your doctor has to identify a number of risk factors that may make a person more likely to get osteonecrosis. However, some people who get the disease do not have any known risk factors. And if you want to know, some of these risk factors can be like an injury. For example, a broken or dislocated bone or a joint injury may damage the surrounding blood vessels. This can decrease the blood supply to the bone and lead to osteonecrosis. Also, the medication, for example, corticosteroids. These medicines commonly used to treat asthma, arthritis, systemic lupus erythematosus, and other conditions act by reducing inflammation. While the reasons are unclear, they increase the risk of osteonecrosis when they are used for long periods at high doses. The risk of osteonecrosis is low when they are used on a short-term basis at lower doses. Also, the excessive use of alcohol and tobacco. It is known that the excessive use of alcohol is a risk factor for osteonecrosis, but why it makes people more likely to develop the disease is unclear. Overuse of alcohol can cause fatty substances to build up in the blood vessels and can increase cortisol. It is a hormone that can cause blood vessels to narrow. And of course, the levels of cortisol in blood also will be increased. Together, these may decrease blood flow to the bone and lead to osteonecrosis. Research has also shown that excessive tobacco use is also a risk factor. There are some medical conditions, and they can be, for example, certain blood disorders such as sickle cell disease, certain types of cancer such as leukemia, decompression sickness, also known as diverse disease, the Benz or Caisson disease, Gaucher disease, gout, HIV infection, pancreatitis, rheumatoid arthritis, also lupus. And we can consider also the medical interventions. Some medical interventions may increase the risk of osteonecrosis, like chemotherapy, kidney or other organ transplantation. The use of corticosteroids to avoid organ rejection may be a contributing factor, and also radiation treatments. And when it is about to describe the types of osteonecrosis, we can name two types. Traumatic, which follows an injury. The most common causes of traumatic osteonecrosis are a bone fracture or dislocation. The second one is non-traumatic, or also known as atraumatic, when there is no history of injury. There may be no symptoms of osteonecrosis at first, but as the disease progresses, you may gradually start to feel pain, especially in weight-bearing bones, such as the thigh bone, known as femur. The disease most commonly affects the hip joint, and the pain is usually felt in the groin or less commonly in the buttock area. Most people first experience pain when they put weight on the affected joint, but eventually the joint may feel painful even when resting. Over time, the joint may stiffen and lose its range of motion, and osteoarthritis may set in. If the end of the bone collapses, the pain may intensify abruptly. The time period between the start of symptoms and loss of function of the joint varies from person to person and ranges from a few weeks to more than a year. Osteonecrosis happens when the blood supply to part of a bone is disrupted, depriving bone tissue of essential nutrients and oxygen. If the affected part of the bone is small and not subject to major weight-bearing forces, it may not cause a problem, or the body's repair processes may be able to rebuild the damaged area. But in most cases, the repair mechanisms do not work and the bone erodes or develops fractures. Eventually, it may break down and collapse. In traumatic osteonecrosis, which develops from an injury, the loss of blood flows is likely due to damage to the blood vessels. The reasons for the loss of blood supply are less clear in non-traumatic cases, but may be due to the blood clots blocking the circulation or elevated pressure within the bone constricting the vessels and decreasing blood flow are thought to be the causes. While the underlying causes of non-traumatic osteonecrosis are not fully understood, scientists believe that genetics, along with other factors such as alcohol overconsumption, certain medications, or other diseases, play an important role. If your doctor suspects you have osteonecrosis, he may take your medical history and do a physical exam. Your doctor may also order one or more imaging tests to see which bones are affected and to assess the degree of bone or joint damage. This information helps determine the stage of the disease. Early diagnosis increases the chance that the treatment will be successful. For example, in X-ray, They are usually the first type of imaging study that your doctor will order because they can also help rule out other causes of joint pain, such as a fracture or arthritis. However, an X-ray is not sensitive enough to detect bone changes in the early stages of osteonecrosis. So, your doctor may order more tests if your X-ray is normal. If you are diagnosed with the disease, X-rays are often used to monitor the bones in the later stages. And when you are required to get a magnetic resonance imaging, it is known by its highly sensitive for visualizing bones and joints and can detect early signs of osteonecrosis before they are seen on an X-ray. A magnetic resonance imaging may even pick up signs of osteonecrosis before you experience symptoms. Magnetic resonance imaging can help provide your doctor with information on the degree of bone damage and the overall structure of the joint. Also, if you are requested to get a computed tomography, it can create a clearer imaging that a plain X-ray does. Your doctor can use a computed tomography scan to assess the extent of bone damage, but they are less commonly used than magnetic resonance imaging because they are less sensitive. The goal of treatment is to preserve joint function for as long as possible. If the disease is caught early, the bone is not weight-bearing and the damaged area is small, the bone may heal on its own, and your doctor may recommend one or more non-surgical treatment options. But in most cases, treatment involves surgery. At first, surgical procedures focus on preserving your natural joint. However, if the disease progresses and non-operative treatments do not work, some people may need a total joint replacement. Your doctor will determine the best treatment for you based on things like your age, the stage of the disease, and which bone is affected and the amount of damage. And talking about the non-surgical approaches, they may help manage the symptoms of osteonecrosis, but generally they do not cure the disease or slow its progression. Your doctor may recommend one or more options like anti-inflammatory medicines to reduce pain and swelling, also physical therapy to help reduce joint tenderness, stiffness, and to increase the joint range of motion. Use a cane or crutches if the bone is weight-bearing to provide support and help relieve pain and weakness when walking. Corticosteroid injections to reduce pain and swelling because they are potent drugs. Doctors will typically prescribe the lowest dose possible to achieve the desired benefits. And now, if you want to know a little bit about the surgery, most people with osteonecrosis eventually need surgery as the disease worsens. There are three main types of surgery aimed at preserving the joint, but if this fails or if the diseased bone has already collapsed, you may need joint replacement surgery. One of these options are core decompression surgery. The second one is the osteotomy, and the third one, bone graft. And total joint replacement as the last option. Living with osteonecrosis means having a painful disease that can be challenging, but the following may make it easier for you to manage the disease. First, you need to talk to your doctor about the types of exercises that are best for you, as well as whether you should avoid certain activities or exercises. Care for your joints by using cold packs to ease swelling and numb pain. Heat treatments such as hot showers or heating pads help smooth stiff joints and muscles. Also, people who have conditions that cause chronic pain are at greater risk of having emotional or mental health problems, such as depression. Consider seeking help from a mental health professional or joining a support group, which can help you learn more about coping with and living with the disease. And I hope you enjoyed this episode, and we will see in the next one. Thank you.